Hello, my name is Sarah Branch and I am the Oncology Matron. Welcome to St Luke's. My team and I are all here to support you through your journey. We hope you find this video useful as you are preparing to start your treatment.
Hi, my name is Claudia and I'm one of the chemotherapy sisters here at St Luke's Cancer Centre.
We hope this video will explain important information about chemotherapy and ease some of the fears you may be feeling right now.
We will follow this video up with a telephone call in a few days' time where we will answer any of your questions. You will find your appointment for this in your envelope.
Included in this video are an introduction to Chilworth Day Unit, the day of your treatment, what to expect, cancer and chemotherapy, side effects of chemotherapy, your alert and chemotherapy emergency contact numbers, what happens after your first chemotherapy appointment. Chilworth Day Unit is situated on level F in the St Luke's wing. It can be accessed by a lift. There are signs to direct you, or please ask a member of staff.
On the day of your treatment, please do not worry. We know this is an anxious period, but we are all here to support you.
And we try to make the process as stress-free as possible. Ensure on the day of chemotherapy you have taken all your regular medications and bring with you any medications you may need during the day, for example painkillers or insulin. Drink plenty of fluids beforehand as this helps with cannulation. Eat breakfast as normal.
We advise on the first day of your treatment that you do not drive. If you feel capable after your first treatment, then you may drive yourself to and from your chemotherapy appointments.
Firstly, a nurse will give you anti-sickness tablets to swallow. Let the nurse know on arrival if you prefer liquid medications. Chemotherapy can be given intravenously via a cannula, a thin tube that sits in your arm which is removed after your chemotherapy has been given. Or, for some regimes, we may be inserting a central line which is in place until no longer required. You will be advised how long your treatment will take in your upcoming phone call with the nurse. As with any drug, there is a risk of an allergic reaction.
You should feel well during the administration of your treatment. If at any point you don't, please let the nurse know.
Firstly, we would like to give you an overview on what cancer is and how chemotherapy works. Cancer cells are abnormal cells that are produced by the body when they lose the signal that controls their reproduction. These cells then start to replicate uncontrollably. Chemotherapy is a systemic treatment. The medication goes into the bloodstream, which then is transported all over the body. It damages cells at different stages of their cycle and stops cells dividing and reproducing. Chemotherapy targets rapidly dividing cells, which are cancer cells, but we also have healthy cells that rapidly divide, and chemotherapy can't distinguish between the two. This is why you may experience side effects. Healthy cells can repair themselves, but cancer cells cannot. If you would like to learn more about the science behind cancer and chemotherapy, simply search "What is Cancer" on the Macmillan website. In your envelope, you will have contact telephone numbers for the Oncology Treatment Hotline, which is the 24-hour emergency phone number. You can call this number if you feel unwell or need advice any time of day or night. This number is the Royal Surrey's main switchboard number on 01483 571122. Please ask the operator to be put through to the Oncology Treatment Hotline. Save this number to your phone or keep it somewhere safe. Chemotherapy can reduce the number of white blood cells in the blood. White blood cells are the ones that fight off infection. If these cells are low, you are more likely to get an infection. It would be sensible to take some precautions, for example, not seeing a friend who has an infection, or going to a large public venue, for instance, a concert where the public may have an infection that can be passed on to you. It's all about being sensible. Symptoms of an infection can include feeling shivery, a sore throat, a cough, diarrhea or needing to pass urine often.
If at any point you're suffering with these symptoms or you're generally feeling unwell, please take your temperature.
You will need to buy a digital thermometer from your nearest pharmacy, or most stores sell them. A normal temperature range is 36 to 37.4 degrees. If you suddenly are feeling unwell, take your temperature. If your temperature is within the normal range, please phone through to the Royal Surrey's main switchboard number on 01483 571122. Please ask the operator to be put through to the oncology treatment hotline. If your temperature is outside this normal range, then please attend your local A&E. This means if your temperature is above 38 degrees or above 37.5 degrees on 2 separate readings taken 1 hour apart. If it is less than 36 degrees, you must attend your local A&E.
It is really important that you attend A&E right away if you have a high temperature, as you could have neutropenic sepsis.
Neutropenic sepsis is when the white blood cells, or the neutrophil count, is very low and you're not able to fight off the infection, and so you can become unwell very quickly. It is therefore important you do not drive yourself. Ask a relative or a friend to drive you, or phone for an ambulance. Rest assured, the professionals will treat you promptly in order to make you feel better. I will now draw your attention to the alert card, or fast track card, which is titled Information for Accident and Emergency Staff. This card should be kept in your wallet or purse at all times. Show your alert card to A&E reception and any health professional so they are aware you are on chemotherapy. This card will fast track you through the A&E department. Inside the card, it has the name of the consultant you are under and the name of the chemotherapy you are receiving. In A&E, they will take your bloods, give you fluids and start antibiotics if an infection is suspected.
Chemotherapy can affect your platelets.
These are cells in your blood that help clotting. If you are noticing any unexplained bleeding or bruising, please phone through to the oncology treatment hotline. Occasionally, you may also notice a spot of blood when you blow your nose or when you brush your teeth. Do not worry if this occurs. Again, perfectly normal. Just make a note and discuss this at your next follow-up appointment with your doctor or nurse. If you develop any bleeding that does not stop within 10 minutes, please either call the oncology treatment hotline or attend your local A&E department.
Sometimes chemotherapy can cause you to have a sore mouth and mouth ulcers.
As a standard, brush your teeth with a soft bristled toothbrush after every meal so food is not sitting in your mouth. If you use a mouthwash, ensure it doesn't contain alcohol in it, as this can irritate the lining of your mouth. If you develop mouth ulcers, you can use Bonjela and rinse your mouth with salt water multiple times a day. If your mouth is so sore it is affecting your ability to eat or drink, you need to phone through to the oncology treatment hotline for advice.
Chemotherapy can cause you to feel sick.
Once your chemotherapy has been administered, the nurse will remove the cannula or de-access your device ready to go home. The nurse will give you anti-sickness tablets to take home. Depending on your chemotherapy, you may have up to 3 various types of anti-sickness, but these will be explained to you before being discharged.
Please take your anti-sickness tablets even if you don't feel sick.
Begin taking your anti-sickness tablets the evening of the day of chemotherapy and continue to take them for the first 3 days. If you do not feel sick after the 3 days, you can stop taking them. If you feel nauseous at any stage, restart your anti-sickness tablets, which will control this. We do not expect people to be vomiting at home, and so please phone the oncology treatment hotline via the switchboard on 01483 571122, as I previously mentioned. If you feel so nauseated you cannot carry out normal tasks, for example making yourself a cup of tea or having a shower, please call the oncology treatment hotline and we can advise you accordingly. You do not have to suffer unnecessarily.
You may notice taste changes or lose your sense of taste.
This will return when you've completed your course of chemotherapy. If you are suffering with nausea and have a metallic taste in your mouth, this can affect your appetite. Try and not let this reduce your oral intake. Find foods you enjoy eating. Be sure to eat food high in calories so your weight does not drop, for example cake, biscuits, etc. We recommend you eat small meals throughout the day by grazing, but if you find you're struggling or noticing a weight loss, we can refer you to the dietitian. We also have a number of patient information leaflets, such as eating with a small appetite. Please inform us at your next appointment and we can give one of these to you.
If you are losing weight rapidly, please phone into the oncology treatment hotline
on 01483 571122 for advice on how we can get you back on track.
Some people get constipated for the first 3 days.
Ensure your bowels are active and take a laxative if necessary. If you have any problems with constipation, please phone into the oncology treatment hotline for advice.
On the other hand, others suffer with diarrhoea.
If you suffer with diarrhoea and have more than 3 episodes of diarrhoea in 24 hours, please phone the oncology treatment hotline via switchboard on 01483 571122 and ask for advice. Drink plenty of fluids, 2 to 3 litres a day, including rehydration sachets.
You are likely to feel tired.
You may feel a dip in your energy levels on day 3 or 4 after your chemotherapy. Please ensure you get sufficient rest. Rest assured your energy levels will pick back up. Chemotherapy can have a cumulative effect, so the more treatment you have, the more tired you may feel. Again, this is perfectly normal and you should not feel anxious about this.
It is for you to judge your own level of tiredness. If it's possible, undertake some light activity, as this can help with fatigue.
You may find that you are too tired, and so it is important you listen to your body and have sufficient rest. If you are so tired you are unable to carry out normal activities of daily living, for example washing, dressing, preparing a meal, please phone into the hotline.
Contrary to popular belief, not all chemotherapies cause hair loss.
If this is one of the common side effects for your chemotherapy, the nurse will discuss this with you during your upcoming telephone consultation. In all chemotherapies there is a risk of hair thinning, but this will resolve once you have finished chemotherapy. You will have received the following materials in your envelope with this video link: the alert card to keep in your wallet or purse, the mouth care leaflet, a treatment plan, and the chemotherapy information card. This has your details and hospital number on the front of the card. It will also have specific details of your chemotherapy treatment inside, along with common side effects of chemotherapy listed 1 to 5. On the reverse of the card is the number for our oncology treatment hotline. If at any time you are concerned about any of these side effects or anything is different to what we have talked through, please contact the oncology treatment hotline on 01483 571122. This is a 24-hour number, 7 days a week. The oncology treatment hotline is an advice line, so please use it if you are unsure or worried about any side effects of your chemotherapy. If you are advised to attend your local accident and emergency department, please present your alert card to a healthcare professional in A&E.
When you leave the hospital after having your first chemotherapy, always make sure you have your next appointment to come back to the hospital.
Before your next chemotherapy session, a nurse or a person trained to take blood will take a blood sample from you.
This is to check that your blood cells are at a safe level to give you your chemotherapy.
We prefer you to have your blood test done the day before your clinic or telephone appointment at a local hospital. You can book to have a blood test at St Luke's by going onto SwiftQ and registering yourself. It is advisable you have a working pair of scales so we can monitor your weight at home. You will speak to a doctor or nurse and they will ask you how you have been feeling. If you're okay, your weight is okay and your blood results are okay, you will receive your chemotherapy within a few days. We have guidelines that we follow to ensure we are giving your chemotherapy safely.
If at any point your bloods are outside these parameters, your treatment may be delayed for a short period.
Again, this can be a common occurrence for patients on chemotherapy, and your doctor or nurse will explain this at the time, so please don't be concerned.
We hope this video has been useful.
You will shortly be receiving a phone call from a chemotherapy nurse at the date and time written on your letter. It may be a good idea to write down any questions or concerns or issues to ask during the phone consultation.
It is never easy to start chemotherapy. We as professionals realise this. We understand you may be feeling anxious. Rest assured, we will make this journey as smooth and stress-free as possible.